Hi, everyone. Today I'm going to describe our startup called nevron.ai. We seek to actually democratize federated learning in biomedicine. This one? Okay. My name is Dimitris Stripelis. I'm a PhD candidate at USC. This startup emerged from my PhD thesis. Dr. Jose Luis Abit is also a co-founder, and we're delighted to have Professor Paul Thompson, who is in our advisory board, and he has 20 more years in neuroscience in biomedical industry and very large research consortia. I'll start with a motivating example. In particular, I want to say that our primary application domain is the biomedical imaging domain. Here, what I show is actually an example of Alzheimer's disease. It's estimated that this year, Alzheimer's disease and other dementias will cost the US government more than $300 billion. So that leads us to the case that we need more methods that are more accurate and more cost efficient and actually can lead us to more savings and therefore better healthcare. Current approaches on that front, we have independently developed groups of hospitals that perform analysis on their limited data. This actually leads to statistical models that are actually very low quality. A second approach is by establishing consortia. The problem with this approach is actually that you are hampered by challenges in the data sharing. What we propose here is actually through federated learning. So our system is a case where we want to enable different hospitals or geographically distributed silos to jointly train machine learning models without sharing their data. What they want to share is actually the locally trained model parameters. Our architecture is secure and private and can be easily deployed and configured and easy to maintain and add new sites. Our mission is to enable secure and private collaboration across biomedical institutions, use federated learning to improve diagnosis, prognosis, and treatment practices. Our product is the MEDS Federated Learning Framework that has been developed with funds by DARPA and NIH, and has been also deployed for scientific purposes and thoroughly tested on very challenging neuroimagic tasks. The monetization plan, this is an innovative monetization plan where we want to enable different hospitals to have, through an annual license, to be able to train machine learning models, create unlimited number of federations, and once these federated models have been trained, then we plan to save them in a secure model repository. After that, the innovative concept is the model inference. So we want to enable different clinics or hospitals that do not participate in the federated training of the models to be able to perform inference queries or predictions of their own private local datasets. That will come with a small annual license fee, and which also includes a number of queries. After that number of queries exceeds, then the plan is to perform a cost per model per query. And the innovation here is also the revenue sharing. So basically, we want to enable different hospitals that contribute to the training of the federated models to give them back the revenue. And some of it is going to stay within Nevron. Currently, in the biomedical AI market, we project that there's going to be an average compound annual growth rate of 30%. Sorry, time is up. Medical imaging, pharma, and genomics, we have is estimated to federated learning can be applied to all of them. Google and NVIDIA are big players. Datafleets is a startup that did an exit last year for $69 million, and Ryan has already raised $10 million. Company, what we ask is one business developer, 5 engineers, capital for 2 years of operation, and access to medical institutions. And finally, we're in the alpha version. We're going to have a release product. We can have a release product by March 2023. And that's it. Sorry, I wasn't in time. Sorry.
All right, let's open it up to questions from our panel.
So help me understand about the federated learning. Is it something to do with the anonymized data sets? I mean, what would be the essential components that would really institutionalize the architecture when you talk about federated learning?
So there are 2 different concepts. One is security, where you have to share in an encrypted space securely the model parameters. We already have an algorithm for that, a secure application. The other is the privatization, let's say, or anonymization of the data. We have algorithms using differential private, which is a different concept in the literature, in the research, that allows you to make sure that none of the data samples that you use during training can be revealed eventually if I release the model. So if I have the model and I give you access to the model, and if you have the data sample, by following a differentially private training approach, you ensure that no data sample can be ever revealed. And the idea is here that the data always remain at the hospital, right? So the training happens on the hospital. The model is being sent down to the hospital, it's being trained, and what you exchange with the outside world is only the model parameters. And that's it.
What info did you exchange?
Only the model parameters. So if I have a machine learning model, a statistical model, what is being trained are only the model parameters. not data. Basically, not data, actual data, raw data. You can think of the model parameters as data, but you can ensure that they do not reveal any information if you make sure that during the training of the models, you ensure that you follow some specific algorithms or certain kind of use cases that can secure or make private your model.
Okay, that way you're taking care of the HIPAA and the high-tech related.
Yes. The data never leave the site.
But when it comes to the then actual applicability in terms of kind of transposing the same kind of treatment programs or treatment pathways to similar kind of patients, how does your model help in kind of replicating it without going through the entire cycle again?
So the idea is that at the beginning of the system, you're going to have a coalition or a federation of 10 hospitals. These hospitals, they want to train on their individual data set because they want to improve their predictions, right? So they want to improve their prognostic approaches. So the assumption is that you're going to generate models from data that the hospitals already have. Yes, maybe they're not generalizable at the end, but we plan to allow these models to be retrained, personalized on data that they didn't see. So the model inference can be an extension where you can download the model, personalize it, and then use it on your own data as well.
Who owns the IP?
So for which part from all of it? Because there are different parts.
If you're calling
So
a nevron.ai, how many patents have you filed?
Definitely we have the IP for the marketplace because it's innovative. It's actually new. The whole idea of inference queries and it comes through USC, right? So we did a provisional patent with USC, and eventually we're going to file a full patent. The idea of the inference queries and sharing the models that have been trained by federation, then that's already patentable. What remains? So the federated learning as a concept came up from Google. It's already open sourced. The paradigm is already there. It's not something new. It's been around from 2016, but commercially viable came, I don't have the year here, but came 2 years ago. Basically, NVIDIA is also one player in that front, but the federal market solutions are actually very in infancy. So we can say that more solutions will come as we proceed.
You said you had IP for the marketplace?
For the marketplace, yeah.
Can you patent protect and marketplace design?
For the business model, the reason is that eventually these federated models, for now, they are only part of the training. The idea of performing inference on them and then have a rewarding system back to the hospitals that did the training is actually something new. So the whole idea of using models that have been pre-trained through a federation approach, and then use that to perform inference, that's exactly what's the new thing. Why also have software that is, what I miss to say here is also the software is also, we're going to release it as open source, but we develop from ground up.
Okay. Because to my knowledge, USPTO stopped considering business models for patentability.
Yep.
Professor also is there, if you want that. Yeah.
Sorry, I'm a co-founder. So there are this marketplace now for large machine learning models, like Hugging Face that you mentioned there. They have these very large pre-trained models, and Hugging Face have a $1 billion valuation. And what they do is these kind of models that have been pre-trained and they're sharing with others. So here's something similar in which we have a federation of hospitals. A hospital may participate in many federations. They train for a given disease like this, Alzheimer's, lung cancer, breast cancer, and kidney disease. Those models have been trained in the federation. They get put in the marketplace, in the model repository, and then other people subscribe for those models, and they can send queries. And it's like a test. You pay, we don't know the pricing here, but it's $1 or $50 per test. Okay. So this idea, and then to incentivize people joining federations, we have a revenue sharing model. It's like a bit of the iTunes model. So every hospital participates in training a model, then they get, like say, 70% of the revenue that model produces. That incentivizes the hospitals to join more federations to participate. So this kind of business model we think is new, and again, there are some precedents on the model sharing, like Hugging Face, that recently was kind of valued at $2 billion. It is pending. So it's pending, yeah.
What's the current plan on how to develop this?
Developers. So we need 5 engineers. We need 1 front end, 1 back end. We need 1 cryptography, so specialized. We also need one data engineer, and we also need the machine learning for the models. It's a heavy-duty framework, but we already have the prototype, so we can already deploy it for research purposes, but we want to make it more scalable. So that will take some engineering work that needs to happen. Yeah. So I also have one slide that, okay, this is actually working. So what I'm showing here is that for a brain age, the brain age classification task, basically, if I have an MRI scan, and what's the difference between the scan of the MRI and your actual chronological age? If there is a difference between those two values, then most likely you are a neurological disease. What I show here is that we deploy the system in a research purpose at USC on different servers, a distributed environment. Basically, the lower the minimum absolute error, the better the model. So we were able to use the entire infrastructure to perform the training. What remains actually to make it more scalable to more remote servers in other regions, let's say, in a more realistic distributed environment. We have realistic bottlenecks during training. And of course, the inference, which is going to be visualization, UI, that you download the model. So it's a more easier engineering work. But the core concept is the DevOps, basically the development operations that need to happen, which is not trivial work.
Is the solution robust to a case in which local models are generated at different times, not simultaneously?
So the assumption here is that you start training, everybody starts at the same moment, at the same time. That idea is the online. So basically, if I already started, then I can join the federation and then somehow contribute. There are different arguments on how somebody that joins now, how it can contribute to the actual global model, let's say, or the federation model at that point. And we also have knowledge on how to incorporate different local models that are going to do it in an online fashion, or they're going to deteriorate the model. We have strategies that are able to actually not make underperform the global model. Yeah.
Sure. The other thing you can do is, you can use pre-trained models too. So to train the federation, you can use pre-trained models. That helps improve the federation. And the point of this slide is the comparison between the single site learning and the federation learning. So when you train federation, you get a better performance of the model. That's basically what it's showing. And if it's a simple environment like the one on the left, you get a bit of improvement and every site more or less does the same because they have more or less the same type of data. You have data that have very different sites. Some sites have a small data or very different from the distribution you want to test. They do horrible. Whilst the federation does always better. So that's the kind of motivation for why federated learning.
Yeah, thank you.
Thank you.